Hi everyone, my name is Elena Bransford and I'm going to be discussing and possibly helping you guys understand the growing opioid epidemic in our nation. So, for years, opioids have been used for different reasons. When they were first introduced in the 1800s, they were referred to as a wonder drug or miracle drug because of how useful they were in the healthcare field. Opiates like morphine and hydrocodone and Vicodin were initially created for post surgeries or patients who have extensive pain, like with chronic illnesses and stuff like that. Over the years, these medications have become a lot easier to obtain because of how quick physicians are to prescribe them. Not only does research show astounding addiction, treatment, rehab, and incarceration rates, but also that opioids are at the top of drug overdose rates. More and more families in America are being affected by this unfortunate epidemic, and it is an existing and growing one. And it's important for society to understand what they are, their history, and how their inappropriate uses are affecting a lot of people and families and communities all over the country so that the epidemic can be stopped and hopefully put to a reverse. So first I'm going to be talking about opioids, the history of them and their misuse. They were introduced in the late 1800s, but the abuse is tracked all the way to that point as well. Although they were known for extreme pain-reducing abilities, people began using it as a cough suppressant and for even less serious reasons. That's before doctors even realized its extremely addictive powers. But it wasn't until the late 1990s that opioid prescriptions actually escalated. At the time, the medical community was being told by pharmaceutical companies all over that patients cannot even get addicted to pain-relieving opioids. But in 2012 alone, doctors wrote 259 million prescriptions for opioid painkillers, and that's enough to give every adult in this country their own bottle of prescription painkillers, which is ridiculous. So beyond those staggering rates of prescription drug use, there was also a spike in illegal heroin trafficking throughout the past 10 years. So with both overprescription of opioids and then heightened heroin trafficking, it formulates an unparalleled opioid crisis. So next I'm going to be talking about the ignorance of opioid usage and how it can lead to overdose, unfortunately. So every day someone loses their life due to opioid overdose. The current epidemic has been acknowledged as a national public health emergency, and according to the CDC, or Center for Disease Control and Prevention, heroin and prescription drugs has unfortunately killed 33,000 people in the year 2015 alone. So that's a number that's scary when you think about it, and it's real, and it shows you how real it is in the nation. So the process of reversing the epidemic, it's obviously not going to happen overnight, but with persistence and knowledge of the topic, it can happen over time. And finally, what I'm going to discuss is the treatment and the incarceration rates of opioid addicts. First of all, jails all over America are being filled with opioid users. And the question that has remained for a really long time is that should jails be creating programs to help people who are incarcerated for these offenses? For years, the question of if addiction is considered a disease has been around, and it is still relevant to this day. So if opioid-dependent inmates had the opportunity to attain treatment while being in jail, it would decrease the number of deaths due to overdose significantly all over the nation. And now we're going to talk a little bit about methadone. And what methadone is a synthetic opioid or painkiller. Is usually used to treat chronic pain, but has also been used for several decades as a treatment for people with opioid dependence. And what's shocking is less than 1% of jails and prisons allow it to actually be used right now. In 2001, a study at which started one of the country's original jail-based methadone clinics in 1987 found that participants were less likely to commit new crimes and more likely to continue treatment after being released. And a 2014 Australian study showed that fewer overdose deaths were listed after being released from jail. And so inmates in jail with certain programs that give them this opportunity have more of an advantage, I feel like, on getting to the road to recovery than addicts who aren't presented with this opportunity, of course. And the more jail-based opportunities for opioid recovery we have in America, honestly, the better. So as I conclude, I just want to talk about how I was personally affected by opioid addiction and how it had a negative impact on my family's life. The war on opioid is extremely difficult, and I've seen it firsthand in my immediate family with how hard and vicious the cycle is with remaining sober and just staying clean and living healthily. I believe so much more could be done, honestly, with seeing how vicious the cycle is. I believe that we can do a lot more to help reverse the epidemic. Scientists and doctors all over have been spending decades researching what could possibly work best to help reduce opioid addiction, and just finding something that would help make it stick and make it a lot more useful with treatment and things of that nature. But with continuous research based off of previous trials, I really do believe that it can be done. With unity communities that struggle and suffer through this unfortunate crisis, I 100% believe it can be solved. So if you or someone you know is affected personally by opioid abuse, just be a light to that person and just continue to love on those who are affected every day. Thanks for watching, and I hope you enjoyed it and learned something new. Bye.